Okay, good morning. We're going to be getting started with today's balance and dizziness workshop. Feel free to type in some information into the text or chat box if you have any questions. And again, you are welcome to text us at the clinic as well if you would prefer to communicate that way. Give you a little bit of background. We do offer free workshops throughout the year, and this is just our 2021 list of what's coming up. You'll see that we have some heel pain and plantar fasciitis is our next one coming up at the beginning of June. We're going to be providing information on everything that you care about, from taking care of yourself as you help move another body, if you're helping to take care of a loved one, or if you have issues with leg cramps, shoulder pain, or you're concerned about living your best life as you age. So feel free to check those out on our website, and we look forward to you joining for those workshops as well. Today, we are talking about balance and dizziness. So a lot of times people think these are two different things, but it's not uncommon for someone to end up with a loss of balance due to dizziness, and sometimes they lose their balance without having any dizziness. So we're going to cover a little bit of both of those today. So I would suggest that the best thing you can do to get the most out of today's workshop is to grab a pen and take some notes, and also ask questions. And if you get through the workshop and you have questions afterwards, reach out to me. I'm happy to answer any questions that you have along the way. So I would appreciate if you would just type in the chat box a little bit about you and what your concerns about dizziness or balance might be doing to limit you from living your best life independently. And I'll keep an eye out on those in the chat box and make sure I incorporate some of those things into our presentation today. We like to customize all of our presentations to the people who are actually in them so that you're getting the best information possible. So a little bit about me. My name is Elena Marino. I am the owner of Marino Physiotherapy. I've been in practice since 2005, and I have a good background as far as education goes. I'm almost done with my second doctorate. I've got a master's in physical therapy. I have 4 manual therapy certifications. I help teach for orthopedics in a local college, teaching physical therapy. And I really enjoy doing these classes. Balance and dizziness, I got into teaching and treating balance and dizziness because it is a little bit more of a complicated system, and I have a pretty extensive background. So I have a reputation for getting the complicated patients, as do all the therapists here at Marino Physiotherapy. So if you look through here, really when people ask me what I do, I tell them I'm a body mechanic. I take bodies and I help them move and feel better. So if there's something between your hair and your toenails that doesn't seem to be moving well or feeling good, give me a call. We're happy to take a look at it. Oh, that is my puppy. Well, he's not a puppy anymore. That is my dog, Murphy, there in the picture as well. All right, let's talk about the plan for today. Today is going to be a pretty short and sweet presentation. We're going to be looking over what happens if you're not protecting your balance. We'll cover the causes of poor balance, how to quickly and easily test your balance, an action plan for improving your balance or your dizziness symptoms, and then we'll have time for questions at the end. Now, I have a question for you. How do you envision your later years? Do you think you're going to be one of those up and at 'em people that's having fun with your friends? Or is this your plan for as you get older? I'll tell you, the biggest reason that people are not able to stay up and about is because it's not safe for them to do so. So how many of you know somebody that the person kept having falls and the family just couldn't keep up with protecting them from having more falls? And they ended up becoming a resident of a nursing home or skilled nursing facility. I don't have too many people tell me that that is their goal in life. So let's look at the consequences of if you're not keeping your balance at a normal level. So falls are the #1 cause of injury-related visits to the emergency room for people over the age of 65. And I want you to think about that. People tend to think that the fall is the problem. In reality, you have to understand why the person had a fall. Was it an issue with their medication? Was it an issue of tripping over the rug in their living room? Was it an issue of their hip fracturing and then they had a fall? Sometimes it's the fracture that causes the fall. So you've got to you can't look at all falls the same. You have to look at each person as an individual and what are the underlying causes of their balance issues. So I want you to just keep that in mind, that we're going to be talking about kind of a wide variety of things that cause dizziness and balance issues, but there's lots of different causes of this. And it's not about just saying, hey, practice standing on one leg. You've got to get to the root cause of why you're having balance issues. And there's different types of balance. There's some people who have a difficult time balancing just standing in place. That is your postural balance. And when we look at your ability to keep your head above your body, that's part of your postural balance as well. And I want you to think about something. Your head weighs about as much as a small bowling ball. So if you imagine, yes, I have a bowling ball here, and I think, let me stop sharing for a second so you can see this. All right, so if you imagine that your head is the size of a bowling ball, is it easier to hold a bowling ball close to you or farther away? Of course, it's easier to keep it close to you. So if your ball or head is above your body, it's easier to balance versus if you're leaning forward. So I want you to keep that in mind. Your posture has a lot to do with your balance. So if you're one of those people that regularly has someone telling you, hey, stand up straight. First of all, it's not always as easy as just standing up straight. So we've actually got a whole class that we do on, am I sharing my screen again? Let's do that real quick. Get you back on here. There are a lot of different causes for people having postural issues that can affect their balance. So if you see someone that you're concerned about for their balance, just telling them to sit up straight is not necessarily the answer there. Now, when we look at static versus dynamic balance, static is just holding still, being able to sit in a chair without falling over, being able to stand up without falling over, versus dynamic balance. A lot of people, they can stand in place, but as soon as they get going, maybe they trip on their toe, maybe they've got some issues going on there. So it's not always the same types of balance issues either. Now, one of the consequences of having poor balance, the biggest consequence that we hear about is either a fall with an impact to the head, which can create brain injuries. It can even create death. And the other one that we tend to see here in the clinic is people who fall and have a fracture. So I want you to think about this. 1 in 5 people who have a hip fracture from a fall will not be alive within the next year. All right. 1/3 of those people who have a fall resulting in a hip fracture will be in a nursing home for at least a year. And how many of you know somebody who's gone into a nursing home but hasn't come back out again? So we really want to be mindful. Your best course of staying out of a nursing home is preventing a fall and preventing some of those issues that affect your independence. Now, I want you to think about this. Do you have strong bones? And how do you know? Have you had a bone scan within the last 2 years? Because a lot of times people will have a fracture and then fall because of it. So it's interesting that a lot of people don't recognize that, oh, I had a fall and a fracture, but I didn't realize that part of that was because of me having weak bones. So definitely be talking to your doctor about your risk for osteoporosis. Now, if you have a single fall, your risk of having a fracture from a fall doubles after the first fracture, and that keeps going up the more falls that you have. And unfortunately, most of these falls are preventable, so they didn't have to happen to begin with. So hopefully the information we provide today will help you to be able to prevent some of those from happening. Now let's talk about some of the causes of poor balance. We've already talked about how posture can be an issue. If you're already leaning over, then you're halfway towards the floor. So being able to improve your posture, and just because you feel stiff and stuck does not mean that has to be your posture. I have people who are at a 45-degree angle leaned forward, that within 2 to 4 weeks, we can get them up to where they're basically balancing their head above their body. Now, some of you may be familiar with something called neuropathy. That's basically a fancy way of saying there's some type of pathology or problem with the nerves. So this could be due to diabetes. It could be due to poor vascular flow to the nerves in, say, your feet, where you don't actually feel the ground. And not being able to feel where your foot is going makes it very easy for you to catch your foot on something, trip on something, or even miss a step where you think one should be. Now, weakness in your hips and legs is something a lot of people don't think about as far as a cause of poor balance. If you're one of those people who gets out of a chair and falls back into it, or has to rock back and forth to get yourself out of a chair, you definitely fall into this category. Because if you don't have enough strength to control your body lifting from a chair, you're not going to be able to counterbalance yourself if you lean too far forward or too far backwards. These are the people who, when they stand up straight, they already start falling backwards because they feel like they're so used to leaning forward that when they do come upright, they feel like they're falling backwards. Now, sciatica. Sciatica is a component of a lower back or hip issue where you're bothering the sciatic nerve, which can send pain down into the leg. Now, this can also, if you have an increased degree of nerve compromise, you can actually end up with turning off the nerve altogether to the point where you can't even lift your toe up off the ground, or that you can't even lift your heel up off the ground. And this inability to control the motion at your foot makes it very easy for you to catch your toe on things and have a tumble. So if you do have back pain that goes down into the buttock or leg, definitely make sure that you're getting a check for your balance as well, because that is a secondary component that we see. We're going to talk about vertigo here in just a moment. Blood pressure issues. If you're on blood pressure medication and you notice that if you go from laying down to sitting up too fast, or sitting to standing, or even worse, the worst thing you can do is go from laying down to standing up really quickly, your heart normally speeds up to keep the blood flow going to your brain. When you're on blood pressure medication, that response is blunted. So it takes a moment for your heart to catch up to keep the blood flow going up when you go from a reclined to an upright position. So if you're on blood pressure medication, you do have to account for needing to pause and sit for a moment before you stand up when you're getting out of bed. Most people, this happens when they wake up in the middle of the night and they have to do what? They have to go to the bathroom. That bladder is calling and saying, I have to make it right now. And what happens is they jump up out of bed and they take 3 or 4 steps and then collapse to the ground because they weren't getting enough blood flow to the brain. So blood flow issues to the brain is a big component of sometimes having dizziness or balance issues, and blood pressure medication is one of the key things that tends to affect that. There are other medications that can make you feel dizzy, that can affect your blood pressure and balance. So it is important to talk to your physician, or a great resource that you don't often think about is your pharmacist. So speaking with your pharmacist to say, hey, what combinations of drugs do I need to be concerned about here? Or what medications may be making me feel dizzy or off balance? They're a great resource to help you with that. Now, if you've had a stroke in your past, that can affect your balance. I have some people who still have balance issues from a stroke. Most people after 6 to 8 weeks have started to been able to compensate. If you are outside of that 6 to 8 week window and you're still having balance issues, there are a lot of things you can do to train and improve that. So do not feel like that's just your life from now on. That is not the case for sure. Now, those are just a quick overview of the common things that we see that contribute to balance issues. There are so many other things involving if you don't have good range of motion in your knee or hip, or if you have a quick change in weight gain, such as a pregnancy, or changes in how you carry your body mechanics, or starting to use a backpack, starting to carry a bag. There's a lot of different things that have to do with your daily function that can affect your balance. And there are a lot of other health conditions that can affect your balance as well. So sometimes we've got to look beyond the standard things and look at what's custom to you to figure out what are the things that are involved there. Now, this video I'm going to show you, if I can get it to play, that is, here we go. All right, this picture, this is what's called your vestibular system. It's on the inside of your inner ear, and you'll notice that blue area, there's a big part in the middle, and then there's those little hallways out to the side. Now, I call that blue part in the middle the foyer, and all of the important stuff tends to hang out towards the foyer. And you'll notice sometimes as we get older, things can dry out in your ear. You're more predisposed to something called BPPV, or benign paroxysmal positional vertigo. And what happens is if some of these little crystals that tend to rest in the foyer get loose and head out into those canals, it can create some problems. Out in the canals, there are little nerve endings. You can see the little crystals kind of going through there. In that little hallway tubule area, there's little, almost like grass in the, like ocean grass, where it moves as water moves. There's fluid in there. And what happens is if you've got some of those crystals bouncing along those nerve endings, it's stimulating them and telling your brain that you're doing something, even if you're not. So if we know that when you turn your head to the left, that ocean grass tends to lean one way, or if I turn my head to the right, the ocean grass leans to the other way. If a little rock comes along and squashes it, and it sends a message to my brain that says, I'm turning left, but my eyes and my neck and my bottom, where I'm holding still on a chair, can feel, no, that's not right. What happens is you get two mixed messages to your brain. Your brain expects to get all of these messages from your body, from your feet on the ground to say the ground is holding still, I must be holding still. From your butt cheeks, if I am leaning off to one side and all my weight's on my left cheek and not my right, those pressure messages are going up to my brain to say, hey, I must be holding still since I have even weight on both hips. Or if I'm holding on to something, say I'm holding on to a chair or a wall, that pressure on my hands sends messages to my brain to say what's going on in space. I even have little nerves that go down into the neck, so that as I turn my head, I'm going to stretch some ligaments and some muscles. I'm going to compress or stretch some joints. And those pressure sensors send messages to my brain to say, hey, guess what? We're turning to the right because this left side is stretching and the right side is compressing. So being able to feel those different inputs are what give messages to the brain. Now, your eyes and inner ear system are two of the biggest systems that will send messages to your brain. So if you notice when you're feeling dizzy, if you hold on to something, it helps the dizziness settle down. If you open your eyes and focus on a very specific point, that can help things settle down. But allowing that dizziness to just kind of, a lot of times people want to just close their eyes and let the dizziness go. The dizziness should settle down within about 30 seconds or so. If it does not settle down quickly, that tells us that those crystals are stuck in a different part of the foyer, not in the hallway. So when we look at those, we've got to look at what is the problem, where is it coming from? Now, in order to get that checked out, let me stop sharing for a moment so you can see this. We have these fancy goggles, all right? And what happens is we put these goggles on you, and then as we move your head, there's actually some little cameras deep inside there that show us with infrared what is going on in your ear. And I'll show you a quick little picture of what that looks like. Sorry, we have a special computer just for this. But if you watch this person's eyes as we move their head, you'll see, all right, we turn the person's head over and it takes a moment, and then you'll see those eyeballs start bouncing, bounce, bounce, bounce. It just takes a moment, and hers actually settled down pretty quickly. But we see this happen quite a bit, where those eyes will start doing that little bouncing. And what that tells us is that your inner ear is saying, we're turning this way, and your eyes jerk over as if you're about to look that way. But the rest of your body says, no, that's not really what's going on, and it corrects. So your eyes will do this little shaking business where they kind of bounce out to the side. That's called nystagmus. So that nystagmus is actually a great way for us to tell exactly where your dizziness is coming from when you're having dizziness. So back to the presentation. We'll go on through here. Just a little bit of information about one of the causes that can give you dizziness. Now, there are different types of dizziness. There's some dizziness that feels like the room is spinning. That tends to come from the crystals in your ear. There are some types of dizziness where it feels like you're on a boat going up and down. That's a different condition altogether. There's some types of dizziness where you feel just woozy, almost like you're drunk a little bit, or that you're on an uneven surface and it's hard for you to stay upright. That dizziness can often be coming from your neck or even from your brain. And there's easy ways to tell exactly where the dizziness comes from, but you do have to have an assessment with those vestibular goggles that we showed you to help us determine exactly where that is coming from. Sometimes that can be done by an ENT, but more typically people will come straight into a physical therapist for that, because in Tennessee, you don't have to have an order from a doctor. You can just come straight in. So if you wake up and you have this dizziness, call us. We will get you in within an hour or two. Get you in, get it looked at, get it settled down. The nice thing about when those crystals come loose is you just turn the head in very specific positions to get the crystals to go back where they were supposed to. Now, if you turn your head in the wrong positions, you can actually make your problem worse. So this is why it's a good idea to actually get assessed with the goggles from a skilled practitioner to make sure that you're addressing the things you need to. All right. Now, what's interesting is you actually have some of the nerves in your neck. As those nerves enter into the spinal cord and go up in the brainstem towards the brain itself, there's actually a way that those can get mixed up a little bit and create dizziness. So we have some people who their dizziness is not coming from the inner ear, it's actually coming from a problem in the neck. These tend to be the people who have posture issues or who have some stiffness in that upper part of the neck. So again, we have to assess exactly where the problem is coming from, or else you're not going to do a great job of fixing it. Because dizziness is not the same for every single person. All right, let's take a look at a couple of preventative options. So some of you might have seen this before, where we have this fall prevention blueprint. Here we go. And we actually have these on our website. If you'd like a copy of them, feel free to give us a call and I can either email it to you or show you where on our website it is. But some of the things you might want to do are take a look around your house. And I tell people, do this with somebody who does not live with you. This is a great thing to do with a friend or someone who's not in your house all of the time, because you'll tend to see the things, oh, I know where that is, I'll step over it. But going through this, looking for areas of slippery floors where floor rugs and mats might be in the way. Throw rugs are a big cause of falls. Making sure that your stairways are well lit and well repaired, making sure that things look good in the bathroom as far as for slip and fall prevention are very important. So again, we'll have this on our website. You're welcome to print that off and take a look. There's some extra things for outside of the home as well. Here we go. Making sure that you've removed leaves and other debris from your walkways. Trying to step on top of leaves that may look dry, maybe wet on the bottom. I mean, I did this last year where I was scooting through a parking lot and I just slid across a whole bunch of leaves. This doesn't mean that you necessarily have a balance problem, but it means that you're in an unsafe situation where you could have a fall. So some things to be mindful of there. Sometimes having falls doesn't mean that you have a problem. It just means you made a poor decision as far as where to put your foot when you took a step. So those are on our balance and fall prevention checklist as well. Now, a couple of things to think about. Have you planned for if you do have a fall? Do you know how to get back up out of the floor? We actually, for our balance patients, take a whole day to teach them how to get up and down from the floor, whether they have a chair nearby or not. Being able to practice your fall recovery is much easier when you know about it and when you've practiced it beforehand, as opposed to trying to do it on the spot. Because if you've just had a fall, there's a good chance you have an injury that doesn't feel good, and you need to know how to get back out of the floor and to get some help. Now, some great things we have available now are the watches. They have lots of watches that will sync to your cell phone. So you can just push a button on your watch and ask for help. Some of the newer watches, I believe the Apple Watch now has an app, program on it that will detect if you've had a fall and will call someone for you, so that if you're unconscious, that process has gotten started. Now, these other items on here, the Amazon Echo and the Google Home, they're great ones to have in those areas where you might not have a phone. So I tell people, put it right outside of your bathroom or even inside your bathroom, so that if you do have something, you can just say, okay, Google, call my daughter. Like I've gotten stuck and I need some help. Something along, oh, I said, okay, Google, and my phone just turned on my Google Assistant, by the way. So it's a great thing. I have some people who will turn that feature on onto their phone. And if they generally have their phone nearby, they can just say, okay, Google, call my mom. And guess what? There it goes. It'll start, it brings it up. Do you want to call your mom? I'm not actually going to call my mom right now because, all right, calling mom mobile. Let's not do that because she's probably busy today. So being able to use your technology to help you in the case of a worst case, yes, you've had a fall and there's no one around to help, is the difference between being able to get up and moving versus laying there in your own mess for days at a time. So it's a little bit of a morbid thought, but if you do have balance issues, you've got to plan what if and how am I going to handle that? Most people think, oh, I can just get up out of the floor. Well, what if your hip is fractured and you can't get up the way you think you'd normally get up? How are you going to get to help? Do you have a phone within reach? Or are you going to have to crawl somewhere? Those are things that are better to plan ahead of time than not. If you're not in a position to be able to practice getting in and out of the floor, even going on YouTube and watching some videos about how to get in and out of the floor and planning, how would I do that in the room I'm in? How would I do that in the bathroom? How would I do that in the kitchen? Just going through that plan in your mind is better than not practicing at all. So I would highly encourage you to be doing some mental practice, even if you're not able to do physical practice. And if you're still unsure, that's a great time to consult with your physical therapist to be able to give you some strategies on how is best for you, your body type, and your current level of fitness. When I go through this line and I say Apple Watch, Amazon Echo, Google Home, Disco Potty, I always get looks from people who are in the room who say, Disco Potty, what is that? Well, let's see if this is a little video. I'm not sure if that little video is going to work. Here we go. So what happens is it detects movement, and if there's movement, it turns a little light on, and it basically turns your toilet bowl into a glowing room. So for those people who get up in the middle of the night to go to the bathroom and think, well, I just know where everything is, having a light to help guide you makes things much easier. So yes, that is a bathroom at my house. And my husband laughed at me quite a bit for putting a disco potty there. But just to demonstrate, it's a great motion detector. And I have some people who will take that and actually put it in the floor on the path to the bathroom so that it turns off. And then as soon as your foot hits the floor, it recognizes movement and turns on a light on the floor. So you're not having to turn on all the lights in the room just to go to the restroom, but it gives you enough light so you can see where you're going. So taking advantage of having a well-lit path between you and where you tend to go, which in the middle of the night is usually the bathroom, is a great plan. Now, let's do a quick little test. Excuse me. So there's something called the 10-foot quick test. It's actually called the timed up and go, but this is one that you can do from anywhere. And basically what you do is you're sitting in a chair, you're going to stand up, walk 10 feet, turn around, walk back, and sit down. And you're just going at your regular pace. And what you want to do is have somebody, all the cell phones have this thing on there now that says timer. So you just click on the little timer, stopwatch, and then you hit start and you watch it go. And you have someone do the little stopwatch to tell you how long it takes you to, from the point where they say go and hit the start button, when they say go, you get up, you walk 10 feet, turn around, come back, sit down, and they time how long that takes. And if your total time is takes 10 seconds or less, then functionally you are at a pretty low risk of falls. But if your time takes you 10 seconds or more, every second extra it takes you to be able to do that walking out and back is going to increase your potential risk of falls and disability. So I want you to think about that. If it takes you 15 seconds to get up, walk 10 feet, turn around and come back, you're really only functioning at about 50% of where you should be. So that can put you in an elevated risk for falls. But this is a great little thing to just a quick test that you and your friends or family can do. And when someone says they're worried about, hey, do you need to be living by yourself? Guess what? Do the quick test. Now we're also looking at, do you lose your balance? Do you need a walker or a cane? So there's some other factors in here as well. But if you're just doing the basic stand up, walk 10 feet, turn around and come back, this gives you a pretty good idea of where you are right now. Now, I don't want you to take this in terms of, I made it in 10 seconds, I'm fine. I want you to take this in terms of, if it takes you more than 10 seconds, you definitely have an issue. If it takes you less than 10 seconds, but you still have either had a fall in the last 6 months to a year, you find yourself almost losing your balance, but just catching it in time, those are things that you definitely want to get checked out. But sometimes it helps to have a quick little test you can use. Now, this is not an official test. It's an Elena original test called the toilet test. And when I was working in the hospitals, they would bring me in and say, Elena, we have Miss Smith here and she's about ready to go home. Is she safe to go home? The easiest thing to do is say, well, let's stand up and go for a walk. If you're able to stand up and go for a walk with no problems, or if you're able to stand up from a low seat, such as a toilet, your risk of falls is much lower. And it's easy to see that you'll be able to be independent at home. If you're the kind of person who has to rock back and forth a few times before you can even halfway get your bottom up and you're leaning over and then you have to pull yourself back up, that's not the safest way to get up and down. So I have this little exercise you can do, and this is also a great key for helping you be independent as you age. It's how to stand up from a chair. There's 3 steps. Step 1, you scoot up to the edge of your seat, all the way up to the edge. Step 2, you get your feet back underneath your butt. Step 3 is you look up to stand up. You'll notice most people, when they're in the habit of standing up, they tend to look down and lean over. If you look up as you stand up, if you look up, you're going to rise up, and it's actually going to use your leg muscles, which will keep the stress off your back. And within about 2 weeks, it'll also get you stronger in your hips and thighs, take the pressure off your ankles, feet, knees, hips, back, and spine. So small thing you can do, if every time you stand up, you look up to stand up, it's going to help you in the long run. But it's also the easiest way to tell if someone is doing a good job with their balance and functional independence, if they're able to just stand up from the toilet, or if they're having to lean over or rock back and forth or use their hands on another surface to help them. So that's a quick tip you can do next time you go to the bathroom, is check, did you pass the toilet test? All right, walker and cane. I want you to think about something for a moment. We see a lot of times where people will use a walker and they're leaned over to reach the walker. The goal of a walker or a cane is for you to be upright and it come to you to support it. Leaning forward into a walker may make you feel safer because you have a wider base of support. But in reality, if you're leaning over to reach the walker, you're halfway. If your walker doesn't happen to support you well, or it gets a little too far out, there's a good chance you're going over. It also starts promoting you walking poorly. So we have some people who we actually turn their walker around backwards for them to use it properly. We have a lot of people who we're just needing to adjust the height of a walker or a cane. If you use a walker or a cane, I highly suggest you swing by for us to do a quick look, make sure it's at the right height for you and that you're using it the right way. I will tell you, if you've seen one of those walkers that it's called a rollator. Let me pull up a picture of one real quick. Those rollators are, how do I say this? I call them job security because they have 4 wheels on them. And if you don't catch yourself in time, if you start to lose your balance to activate the brakes, that's not great. And what happens is it starts wheeling away from you and you end up falling over. So here's a picture of one. And they used to call them the Cadillac of walkers. And I'll tell you, they're probably one of the more dangerous things that I see people work on. And everyone gets excited because they're like, oh, it has a seat. So let me stop sharing for a second. You've seen that rollator before. You've seen people at the store with them. First of all, they're too short for you unless you are 5'2" or less. And there's better options out there. So I'd say probably my favorite one is the Drive. It's called the Clever Light Walker. Let me pull up a picture of that one real quick. And the cool thing here is it has a seat that pulls down. So there's a picture of that one. And it has a seat that pulls down, and it also has automatic brakes. Where's my finger? It has automatic brakes in the back. So you're not having to stop and catch yourself. This one is also wider, so you have more room for your butt to sit down, and the seat is much higher than the other one, so it's much easier to get up and down from. So if you are needing a walker, I don't have any stock in this company. That's just the one I recommend for my patients. It is called the Drive. Here we go. That's what it's called. Drive Medical Clever Light LS Walker Rollator. And I think you can usually I have people get them from Walmart, and it's like 70 or 80 bucks. So it's not that expensive for having a better quality walker than those awful ones I showed you to begin with. That basic rollator, everyone wants to get one for grandma, thinking it's going to help her. It gives her a place to rest. It seems like it's going to be safer for her. It actually ends up creating more problems in the long run. So I highly encourage you to not get one of those rollators if you're having dizziness issues. If you're not sure, it's better to just get an assessment and find out, do you need a walker? Do you need a cane? Or do you need like a 2-minute stretch every morning so you can walk normally? I'll tell you, I know a lot of people who would appreciate having just a 2-minute stretch and being able to live their life independently. So that's my little commentary on walkers. I'm happy to, I can do a whole talk on walkers and what's good and what's bad. Those stand-up walkers that have the 4 wheels, they're not much better than that little bitty short one. Again, if you have questions, I'm happy to walk you through that. Let's talk about the single biggest mistake that people with balance and dizziness issues will make is they ignore it. They let things go for a long time until you're actually having falls multiple times a week before you'll actually address it. Everyone is concerned that, oh, well, if I don't have good balance, it means I can't live on my own and people are going to take my independence away. It's better to address these things early and know what's going on. You've heard the expression, an ounce of prevention is worth a pound of cure. Guess what? A week of balance work is better than years of assisted living care. So it's better to take it out. I'm not sure why we have toughing it out and Advil on here. That doesn't affect your balance. I think this was a carryover slide from our back pain workshop, but quit making excuses and do something about it. If you find yourself kind of tripping or losing your balance and or having to hold on to furniture or being a little unsteady, if you're walking around the yard to do your gardening or just walking through the yard to go greet someone, if you're having to watch the ground as you walk to feel safe walking, you've got a problem. So I want you to be thinking about that. There's ultimately only 3 things you can do. You can ignore the problem. It'll probably get worse and you'll probably end up in a pickle with either having a fall with injury or being hospitalized or even being sent to nursing care. You can alter it by getting one of those awful types of walkers and just hoping it keeps you from falling, or you can actually handle it. Handling it is where you go the physical therapy route. So some things to look at with physical therapy. When we look at a person with balance issues, the most important part is not to put you in a balance program. It's to do a thorough assessment and find out what are your specific issues that are affecting your balance. I have some people who just need some help with their neuropathy to feel the floor, and they do fine. I have other people who just need to be on our posture chair for, say, a week so that they can get to know what's going on, so that they can correct their posture, do a little stretching, and then they're upright and not falling over. Everyone's a little different in what they need. Here at Marino Physiotherapy, we do a lot of hands-on. So if your problem is that you're not able to stand up straight, you probably need someone to get in and get those joints in your spine moving well in the right direction to help you be able to stand up straight. Just telling someone to stand up straight is not going to work. If they're leaned over, it's either because something hurts or something's not working well. That needs a thorough assessment. We do have some people who need stabilizing and strengthening exercises in their hips and legs. We have some people who do really well with what's called unweighted gait. I'm going to show you what that looks like here. I'll just take you on a tour here in a second. We do unweighted gait, we do aquatic, we do vibration. Vibration does a great job for your what's called proprioception. It's your body's awareness of where your body parts are in space. So if you start to put your foot down, it lands on the ground when you expect for it to. Doing pool therapy is a great way to get where you're doing a lot of dynamic movements in a safe environment. And we also we have a system that has a harness on it that, so if you start to lose your balance, you can't fall. It allows you to fall maybe about 4 to 6 inches. So you have just enough room where you're catching yourself, but it keeps you in a safe environment. So I have a lot of people who just need that practice. And if you're not out and about and skipping and hopping and jumping and doing those types of things each day, you'll tend to lose your ability to do so. We also take that harness system and we have a big TV and a Wii balance board and we play games on it. And I'll tell you, I think the staff has more fun than the patients do on that thing, but we have a good time with it. All right, so let's show you around what these look like. Da-da-dum. Let's stop sharing. I'm going to give you a quick little tour of the clinic. All right, so the room that I'm in now is called the Balance and Gait Center. And as we come through here, you'll notice we have this giant frame, okay? And that frame, that'll slide back and forth, and we have a harness system that goes with it. So whether you're learning to walk on a treadmill or we have you in front on the Wii balance board, and this over here is our posture chair. So we have a little system that we use where we do what's called mapping your posture. And you might have seen this little device in the background while I was talking, but we actually will take and trace your posture and take the information, some numbers from there, put them into a computer, and it pops out a report that tells us what you need to be working on. Now, a couple of other resources that we have here in the clinic, aside from our lovely waiting room that I'm walking through, it's going to be, so this is our balance plate. And basically we have some people who just put their foot on top of here. They sit in a chair with their feet on the balance for about 6 minutes. And it is a great thing for neuropathy and being able to get better sensation through your legs. Now, this is a little fun thing that we've got. We have an education center where we're teaching people, oh, we need to make that bed back up, where we're teaching people how to safely get in and out of bed and in and out of chairs. And we affectionately call this the car wash. Yes, there is some fake grass there, and there's some obstacles underneath the grass that help us kind of throw off your balance. And it's set up like a little bit of a maze for you to go up, down, under the balls, around the noodles, and to be working on your balance in an environment with a little bit of a challenge. You are held on to by a physical therapist while you're doing that. Finally, I'm going to give you a quick tour. We have our pool. So that's our pool with shower and a couple of dressing rooms. And our pool actually has a current in it that allows us to make things a little bit challenging for you. All right, let's pull up the presentation again. Share screen. So just to give you a little bit of an idea of some of the things that you can do to improve your balance without having to do any of the scary stuff. So it's pretty easy to take care of your balance. You just have to do the work. Let's talk about some resources. I will tell you, most physicals every year, the doctor comes, checks your reflexes, checks your medications, checks your blood pressure, asks how you're doing. If the doctor does not watch you walk, you're missing out on a lot. You have to be your own advocate. If you've been having some small falls, talk to your doctor or physical therapist about it. Making sure that you're not having issues with bone density, any medication interactions, those are all important to your balance. Don't be afraid to ask your doctor. OsteoLink is one of the places I get a lot of our osteoporosis information from, if you want to check that out. And it's okay to Google it. And maybe Google up a YouTube video on how to get in and out of the floor after a fall. There's tons of resources out there, and I highly encourage you to be your own advocate and know what's going on. Okay. Next, you have to have an action plan of getting better. So do a fall risk walkthrough in your home and the common places that you tend to be with a friend, looking for hazards, especially the ones at night when the lights are off between the bed and the toilet. Do an inventory. What are your balance risk factors? Do you have medication issues? Are you on blood pressure medications? Have you had that spinning kind of dizziness before? Oops. All right. Talk to your doctor or physical therapist about your risk factors and ask for a consultation. We do those here at Merino Physiotherapy. If you have any questions, you can give us a call or you can send us a text message at 865-236-0340. We have lots of patients who prefer to text us because they think about it in the evening or on the weekend and just want to reach out real quick. If you have questions or if you have an emergency, not an emergency, if you have an emergency, go to the emergency room. But if you have something come up and you're not quite sure what to do about it, send us a text message. We have a therapist on call for just to answer questions if needed. I will tell you, I'm usually the therapist on call, and if I'm out hiking, I might not get your message until I get back. but it helps that you have a resource in your pocket to be able to help you out when you have questions. All right. I'm going to go ahead and finish this up so I can turn off the recording, but I will stick around for those of you who have any questions right afterwards. I really appreciate you taking the time to join us for our Balance and Dizziness workshop today. We are online. We're on Google and on Facebook. If you thought this was a great webinar, I really appreciate if you would leave us a review. When people see our ads and they are like, hey, are they really just talking about the topics that we want to hear about? Yes, that's what we're here to do, to educate and elevate Knoxville. So if you have a moment, we would appreciate you taking a moment to leave us a review. If you would like to set up an evaluation, it is covered by most insurances. Just give us a call. And we do offer a lot of other workshops. If you'd like us to come out and do one of these workshops for your private group, whether it's a church group, a civic group, your gym, your ladies group, like any of those, we do go out and do those on site within about a 10-minute radius of the clinic. Feel free to call and chat with us about what you're interested in. Again, our therapists are the most credentialed and qualified in the region. We don't have locations all over the place. We have one center of excellence on Cross Park Drive over in West Knoxville. So we have specialists in several different areas, and we are happy to help you out however we can. So I hope that you have a great weekend, and call us if you have any questions. I'm going to pop up our other workshops that we have coming up. So if you are interested in them, definitely give us a call and we will be happy to get that information for you. All right, these are upcoming workshops. There you go. And we will have these on the website. Some of our popular ones, the caring for the caregiver one is a popular one. If that's something you're interested in, we will be doing that with a hospital bed and teaching you how to safely move somebody back and forth. We limit that class to no more than about 8 to 10 participants because it is a very hands-on practicing course. Back pain and sciatica, if you or someone you know have problems with back or leg or buttock pain, that's a great one to help get out of pain without medications, injections, or surgeries. And finally, another popular one we have is where we talk about nighttime leg cramps. So if those wake you up, definitely that's a don't miss. All right, well, I'm going to shut this off for the recording and I'll stick around and answer any questions. For those of you who are watching this as a recording, I hope you have a great day and call me if you have any questions. All right, guys, you all have a great weekend.